Part of what we want to talk about is sort of from an age perspective, as well as from a condition specific injury sort of a perspective. What does it take to help people get to a better place with these situations? And so just to establish some of the epidemiology, it is a major cause of death and disability. It has been that way for, pretty much the history of humankind. Head injuries have been beyond problematic. Spasticity. Spasticity is such a problem with everybody who's ever had a brain injury because it's your body basically is out of control. It's doing stuff that you don't want it to do. And the major pharmacologic agents that are used for spasticity fall into these four categories. Benzodiazepines, which is your Valium, your Xanax, your Ativan, and these are all GABA subtype A receptor agonists, and so they increase GABA activity. We started around 40 sessions of hyperbaric oxygen. So basically putting a person who's had a brain injury into a higher pressure environment helps a brain and a nervous system figure out how to navigate a higher pressure environment. It allows also access to deeper brain structures for different therapeutics that you might have done before you went into the HBOT. We didn't put supplemental oxygen in at this point in time. Often we will. If we worry that somebody's going to have a seizure activity, then we won't right off the bat until we see what their response is. The ketogenic diet. With this little guy, we did do a ketogenic diet because what are you going to do? In his case, so long as while we were on that, and when we started it, oh boy, we could do a whole class on the ketogenic diet. Let's just say that 8 years ago, I had a conversation with a neurologist who said, what people eat has nothing to do with their brain.